name's Ethan. I'm a registered nurse. I work in a hospital. I've worked in a lot of different areas over the last several years, and what my intent is by starting this channel and posting videos is I would like to address some issues, misconceptions about nurses and what we have to deal with as far as patients when they come into the hospital, issues they have while they're at the hospital and during discharge. Also, what it's like dealing with some physicians, why things may take so long to get done, as far as getting medications reconciled once you're admitted into the hospital, or why it may take so long to get you discharged from the hospital. During your hospital stay, why it may take so long to get something for pain or nausea or itching or blood or whatever it is that you may have to wait on. This isn't just for people who have been patients or who are expecting to be patients. It's for anyone that has a general question about nursing. I don't know everything, of course. Nobody really does. I've worked in several different areas. I know people who specialize in various areas, but of course I'm not going to give any medical advice as far as this is how you take care of this problem and apply this and medications. I'm not going to do those sort of things because of course that could get me into a lot of trouble, and I don't want to lose my license over it. I may say what I might do, but you should really talk to your doctor first before you do anything, depending on what the situation is. So what kind of questions do you have for me? If I don't know the answer, then I can probably find the answer somewhere or ask somebody that I know who specializes in an area. And I'm not going to go extremely into detail if it's about a specific disease process like congestive heart failure or atrial fibrillation. Something complex that's going to take a lot of time and a lot of teaching. I will, however, find information that's credible from a credible source online, and I will put links to it below the video that addresses that issue, so you can at least read up on it and find more about it. I'll explain some of the general concepts of whatever disease process or health issues that you might ask about. But I don't want this to be totally formal-like, and I like to have a little bit of fun. So I may joke around a bit, but of course, there's no profanity or anything gross or anything like that. I don't do that kind of thing. I just want to be able to teach. I like teaching, and it's part of my job for patient education. As far as, why do we use an incentive spirometer after surgeries? Why do we use what we call EPCDs, or the pneumatic compression devices that squeeze your legs, fill up with air and squeeze your legs, and why do we do things like that? And why do they make us go in and wake a patient up every 4 hours to do vital signs and assessments, and then we have blood draws, and we have respiratory therapy, and I work night shift, by the way. So day shift, I know several people, well, quite a few people, that work day shift, and things are a little bit different there. But at night, that's what I'm really more familiar with. I can still answer questions about day shift, and even if it's something that I don't know, I can ask. And then, of course, hospitals are different from one place to the next. They have different policies, procedures, and one hospital may have you go in and check vital signs every 8 hours. Another one, like where I work right now, they may have you go and check them every 4 hours. And depending on patient condition, it may be every hour or every 2 hours. It really is individualized care when it comes down to it. There are some things that is kind of a blanket procedure for everybody, but that's the baseline. So ask me your questions, comments, concerns. I'll do my best to answer those, find links, more information for you. Just let me know what you want to know.